Professor Dr. Tarek Ali. Today I will speak about an important clinical topic or a medical topic commonly met with in clinical practice, which is drug resistance. Drug resistance أو المقاومة للأدوية, and the most common form of which is the antibiotic or antimicrobial resistance. What's the drug resistance? Drug resistance means that inadequate action of the drug. That is, the biological action of the drug is no more evident, and there is inadequacy of the biological action of the drug inside the body, so that there is an inadequate response or complete failure of response to the drug concerned. فهي عدم قدرة الدواء على إنتاج مفعوله البيولوجيكال أو loss of its clinical adequacy, loss of its clinical efficacy, or loss of its clinical adequacy, that it is no more clinically adequate or no more clinically effective. So this is the definition of drug resistance. And the drug resistance can develop to almost any drug, but the most common forms of drug resistance is the antimicrobial resistance, especially to antibiotics, or what we call antibiotic resistance. And also resistance to cancer drugs, that is chemotherapy, or to biological therapy, as the recent techniques or the recent pharmaceutical manipulation of malignancy and the therapeutic intervention in cancer patients. So when there is inadequate response of the cancer drug or the anti-cancer drug, whether a chemotherapy or other new modalities of therapy, especially biological drugs or biologics in treatment of cancer, this is what we call treatment resistance. That is, the drug concerned is no more able to kill the cancer or to treat the cancer, whether it is a complete failure or partial failure. يعني في فشل جزئي أو فشل كلي في إن الدواء ينتج مفعوله داخل الجسم. This is also called the chemotherapy resistance. Also, there might be resistance to other drugs, like to antihypertensive drugs, for example, to anti-diabetic drugs, to anti-bronchial asthma or anti-asthma or anti-epileptic drugs. The resistance can involve any drug group or any therapeutic drug group or individual drugs used in the treatment of a particular disease, whether this is an acute disease or a chronic medical disease. But let me speak about the most common form of the one of the most important roots or reasons or causes of resistance may be genetic in origin, or what we call the effects of genes in the pathogenesis of drug resistance. That is the what we call the pharmacogenetics and its relation to drug resistance, pharmacogenetics, and its relation to drug resistance, and also its relation to the pharmaceutical drug response or the pharmaceutical drug effects inside the body. And the responsibility of the what we call the genome of the person in the ability of the body to respond to a certain medication or group of medications used in a specific medical disease, as I mentioned, whether acute or chronic. So the genes may play, or what we call the genome of the individual patient may play a role in the resistance to the specific drug or group of drugs. And this is what we call spontaneous resistance or genetic resistance or innate resistance. That is, the person is born with the genes responsible for the manipulation of these drugs inside the body, and this is what we call the pharmacogenetics. So there is resistance to the effect of drug or a drug group. So genes may play a role. But let us talk about other acquired causes of drug resistance, and to be more concise and to the point, speak about the causes of antibiotic resistance or antimicrobial resistance. The most common cause of antibiotic resistance or antimicrobial resistance is the overuse of the medications or the misuse of the medications. So the overuse and the misuse, both of them can be the underlying causes of antimicrobial resistance. When the antibiotic is wrongly used or is abused, or what we call in general antibiotic abuse. For example, the inappropriate clinical use of antibiotics led to the development of what we call acquired resistance, because the resistance may be either primary or secondary also. The antibiotic or the antimicrobial may be effective at some stage when given to the patient, but when given at another time in the future, the patient develops or will have or will show a resistance to the antibiotics. So if the resistance develops from the first use of the medication, we call it primary resistance. And if it develops after later on with consequent or repetitive use of the same medication, we call it secondary resistance. So whether primary or secondary, it's related to the antibiotic or antimicrobial abuse. There is abuse of the medication. There is في إساءة استخدام لهذا الدواء وبالذات المضادات الحيوية أو الأدوية اللي بنستخدمها في علاج الالتهابات الجرثومية، سواء كانت بكتيريال، أنتي بكتيريال أو أنتي فيرال أو even أنتي فانجل أو أنتي بروتوزوال أو أنتي parasitic medications. Any antimicrobial, but it's most commonly met with in antibiotics, that is antibacterial medications due to antibiotic abuse. يعني إساءة استخدام الدواء. زي ما احنا عارفين, for example, antibiotics are given inappropriately and inadequately, for example, to treat non-bacterial infections. For example, it is commonly given even by junior doctors or even sometimes by senior doctors to treat patients with viral infections, which is wrong. We don't give antibiotic to treat flu or to treat common cold. This is a very common mistake in clinical practice. Doctors giving or healthcare providers giving antibiotics to patients with just viral infections without any concomitant bacterial infection or super infection or secondary bacterial infection. There is no evidence of bacterial infection. They are just giving it as a part of the regimen given to treat common cold or flu. This is wrong. Antibiotics is not a drug to treat common cold. Common cold is a viral infection. It is due to rhinovirus. It is treated by other measures, antiviral or conservative or other symptomatic measures, and it resolves by itself later on. But giving the antibiotics without any clear indication, this is not clinically justifiable. It is not justified clinically, and this is a form of, or this is a very common example of antibiotic, what we call antibiotic abuse. Giving them in non-relevant clinical conditions, which is not bacterial in origin. This is the most common cause of antibiotic resistance. Abuse, whether due to overuse of the same medication, what we call antibiotic overuse, or misuse, that is giving it to the wrong indication or in the wrong clinical situation. It's not justified, so this is misuse. So overuse and misuse fall under the heading of abuse, antibiotic abuse. Or it's maybe due to, as I mentioned, spontaneous resistance, or maybe due to what we call transmitted resistance, or resistance overlap. That is, there is resistance, for example, to penicillins, and it is transmitted to another group or another group of antibiotics in the same domain, which are beta-lactam antibiotics, which are cephalosporins. So resistance transmitted from penicillins to cephalosporins, because both of them are beta-lactam antibiotics. This is called also cross-resistance or transmitted resistance, this cross-resistance. So there are four main causes of resistance: overuse of antibiotics, misuse of antibiotics, transmitted resistance or cross resistance, and spontaneous resistance. That is resistance arising from the beginning or primarily without previous misuse or cross resistance. This is spontaneous resistance. So these are the four main causes of antimicrobial resistance. And then we come to another heading, which is very important, which is what are the mechanisms of antimicrobial resistance or drug resistance. Number one, it may be due to what we call inadequate drug uptake. So inadequate drug uptake is number one mechanism. Inadequate drug uptake by the tissue or by the receptors involved or by the bacterial. And the drug is supposed to attack the bacteria, so it should bind to a specific receptor in the bacterium and kills it. So inadequate drug uptake, this is number one mechanism. Number two is what we call inactivation of the target or modification of the target. That is the target, the biological target in the bacteria involved. So inadequate activation of target or inactivation of the target or modification of the target may cause failure of response or drug resistance. So there is a problem at the receptors or at the biological target, and this is what we call inactivation of the target or modification of the target. Number three, what we call overproduction of the target or enzymatic bypass, and this is also very common. And then we have inactivation of the drug by production of enzymes by the bacteria. The most common example is the beta-lactamases. And this is what's called beta-lactamase producing bacteria, which kills and inactivate the drug. So the problem or the mechanism may be inactivation of the drug involved, namely the antimicrobial or the antibiotic, by production of specific enzymes by the which causes inactivation of the chemistry of the drug, or by a transmission of a specific chemical group to the bacteria and causing its of the drug, causing its inactivation from the bacteria to the drug, causing its called chemical group transfer, or destruction of the chemical structure of the drug itself by enzymes produced by the bacteria, most commonly beta-lactamases. And then number four is what we call the active drug efflux. That is, the bacteria is able to expel the drug itself and causes its efflux by different chemical mechanisms at the bacterial or at the cellular level. So this is what we call active drug efflux. So these are the four main mechanisms of antibiotic resistance: the inadequate drug uptake, or number two, modification of or inactivation of the target. Number three, inactivation of the drug. Number four, active drug efflux. These are the main or the four main general mechanisms of drug resistance. And this also can be involved in the resistance to other groups of drugs, as I mentioned before, resistance to cancer drugs or to chemotherapy or to biologic therapy or to other groups of drugs used in the treatment of disease, especially those used for treatment of chronic diseases. Like the development of resistance to biologic therapy used in treatment of bronchial asthma, or biologic therapy used in treatment of epilepsy or migraine, or the patient may develop some sort of resistance so that the drug becomes clinically ineffective or inadequate and no more effective in treatment of the disease. The drug, the body is resistant to the effect of the drug. So it's not just the bacteria is resistant, which is the most common form of drug resistance, but there are other types or other forms of drug resistance which might develop in the human body, and this is a very common clinical challenge met with in treatment of diseases. While we the doctors or the healthcarers are giving medications to treat diseases, whether, as I mentioned, acute diseases or in chronic medical diseases. This topic is very important, drug resistance, and especially the most common, which is the antibiotic or antimicrobial resistance. Stop using antibiotics to treat viral infections. This is a wrong medical behavior, and this is a very common clinical mistake. Doctors should stop this habit, which is very common in clinical practice because it is transmitted from doctors to patients, abuse of antibiotics or abuse of drugs. Stop abusing medications. Before I finish, I have to mention also another important form of resistance is resistance to addicting medications or addictive drugs or the drugs used in what we call drug abuse or substance abuse, like the use of CNS medications in treatment of psychiatric diseases and treatment of other neurological diseases, the sleep medications, the medications for anxiety and for depression, and the addictive drugs like cocaine and like hallucinogens, which become clinically ineffective with the passage of time, and they are no more effective when the patient repetitively uses them and overuses them, and this is what we call drug tolerance. The patient's no more responsive to medications. So tolerance may be also some form of drug resistance. Drug resistance is very common in clinical practice. Clinicians should focus on this. Patients should be aware of this. There must be health appraisal of this clinical issue, and this is a responsibility of the healthcare profession and of the healthcare society and of the healthcare system in general to teach people how to avoid and how to prevent the very common clinical problem of drug resistance, especially antibiotic resistance. No antibiotics, please, for viral infections. Stop using antibiotics to treat common cold or influenza. Thank you so much, Professor Dr. Tarek Ali.